Have you ever wondered why some skin rashes tend to appear in very specific spots on your body, almost like they have a favorite place to show up? Understanding these patterns can be a powerful clue when trying to figure out what might be going on with your skin. When comparing psoriasis and eczema, a key difference lies in the typical body areas they affect. Psoriasis commonly appears on extensor surfaces like the outside of your elbows and knees, your lower back, and the scalp, often forming thick, silvery scales. Eczema, particularly atopic dermatitis, frequently favors flexural areas such as the inner elbows and behind the knees, as well as the face and neck, and usually presents with red, itchy, and sometimes weeping patches. The reason for these distinct patterns is rooted in how each condition interacts with your skin and immune system. Psoriasis is an autoimmune condition driven by an overactive immune response that speeds up skin cell growth. It tends to thrive in areas that experience friction or trauma, known as the Koebner phenomenon, such as elbows and knees. The skin on these extensor surfaces is also often thicker and more resilient, which can accommodate the rapid cell turnover seen in psoriasis. In contrast, eczema involves a compromised skin barrier function, making the skin more susceptible to irritants and allergens. Flexural areas, with their warmth, moisture, and skin folds, create an environment where this impaired barrier is particularly vulnerable, leading to the characteristic itchy, inflamed patches. Recognizing these common location preferences can help you better observe your skin and communicate effectively with your healthcare provider. For instance, if you notice patches on both your elbows and scalp, it might lean more towards a psoriasis presentation. However, if your primary concern is an intensely itchy rash in the creases of your arms and legs, eczema could be a stronger possibility. These observations are valuable pieces of the puzzle for a proper diagnosis. It is also interesting to note specific subtypes that highlight these location trends even further. For example, inverse psoriasis, a less common form, actually appears in skin folds, such as the armpits, groin, or under the breasts. However, it still maintains the smooth, red, and often glistening appearance characteristic of psoriasis, rather than the typical scaly plaques. Conversely, dyshidrotic eczema, a type of eczema, typically affects the palms of the hands and soles of the feet with tiny, itchy blisters, showcasing how specialized immune reactions can target very precise areas. Understanding where psoriasis and eczema typically manifest on the body provides a clearer picture of these two common skin conditions. This knowledge empowers you to differentiate between them more effectively and guides you in discussing your symptoms with a doctor, ensuring you receive the most appropriate advice and care for your specific skin concerns.